These ambulance workers are angry. In their own words, they are done. They do an incredible job in the toughest of circumstances and face real pressures getting through this cost of living crisis. Our message to the government is clear: talk, pay now. Instead, they've made things worse by demonising ambulance workers who provided life and limb cover on strike days. The same people who left picket lines to rush to save lives. The government is playing politics, playing games with their scaremongering. The people of our country will not have it. Public support for ambulance workers has been incredible. It's clear the only way to resolve this dispute is to make GMB ambulance workers a proper pay offer. But it seems the cold, dead hands of number 10 and 11 Downing Street are stopping this from happening. In the face of government inaction, we are left with no option but to take industrial action. GMB's National Ambulance Committee has agreed the following national strike days: Monday the 6th of February, Monday the 20th of February, Monday the 6th of March, Monday the 20th of March. The NHS trusts that will be affected are North East Ambulance Service, North West Ambulance Service, Yorkshire Ambulance Service, the Welsh Ambulance Service, East Midlands Ambulance Service, South West Ambulance Service, South Central Ambulance Service and South East Coast Ambulance Service. In addition, members at West Midlands Ambulance Service will be taking strike action on Monday the 23rd of January, and members at North West Ambulance Service will be taking strike action on Tuesday the 24th of January. GMB ambulance workers are determined and resolute. They're not going to back down. It's up to this government to get serious on pay. We are waiting. Thank you.
OK, so there you have it. Rachel Harrison there from the GMB union saying they've announced 4 more days. Let's bring in Beth. So those days, Beth, the 6th of February, the 20th of February, the 6th of March and the 20th of March. And Rachel Harrison saying there that they are done and they aren't going to back down.
Exactly, 4 more national strikes days, 2 more regional dates. It's affecting 8 ambulance services across the country. And you heard what the union said there. Workers are determined. They're not going to back down. It's up to the government, they say, to get serious on pay. We are waiting. So 4 more national days of ambulance strikes announced, as we expected, but still bad news for the country. And it was the theme of Prime Minister's questions today. Keir Starmer no doubt knew that this was probably coming, and he focused all of his questioning around ambulance sites and the real-life consequences of what it means for people with emergency conditions in dire need of ambulances and ambulance not arriving in time. I think we have a bit of the exchange there, so let's listen into what the 2 leaders had to say.
Mr. Speaker, it's 3 minutes past 12. If somebody phones 999 now because they have chest pains and fear it might be a heart attack, when would the Prime Minister expect an ambulance to arrive?
Mr. Speaker, it's absolutely right that people can rely on the emergency services when they need them, and that's why we're rapidly implementing measures to improve the delivery of ambulance times and indeed urgent and emergency care. But I'd say to the honourable gentleman, if he cares about ensuring that patients get access to life-saving emergency care when they need it, why won't he support our minimum safety legislation?
OK, Beth, so that was the exchange there between Sir Keir and Rishi Sunak. You've been speaking to the GMB union. You've been with them this week. What have they been telling you? I mean, Rachel Harrison is so categorical there. Our message is clear: talk, pay now.
Yeah, I mean, this has been the running story, Kimberly, since December, the beginning of December, really, where the strikes started to pick up and there was, you know, a repetition from both the nurses' unions and the ambulance unions and ambulance workers that they wanted to talk on pay. The whole way through this, the government has said, we have done the pay deals, we are not reopening the books, we are not revisiting pay from April 2022 to April 2023, and neither side are backing down. Now, as I was saying earlier, I think there are some glimmers of hope. The Prime Minister slightly changed position at the beginning of this year, said, I do want to talk. He wasn't categorical about absolutely not talking pay anymore. But the issue that the Health Secretary, Steve Barclay, has is that if he wants to do a pay deal with nurses to improve salaries, and the pay settlement to April 2023, at the moment, the Treasury and Number 10 are saying you're going to have to find that from the existing NHS budget. Now, the Chancellor, Jeremy Hunt, awarded an additional £6.6 billion over the next 2 years to the NHS back in the autumn to help to deal with some of these emergency backlogs and issues that are being faced. And I guess the question is, or the argument that the Health Secretary is saying, I will have to take that out of services budgets to pay staff more. But staff are insistent that they should be paid more. As I was saying, the public are sympathetic to nurses and ambulance workers rather than the government. And at the moment, the discussions, which are all behind closed doors, is all about whether or not there could be some fudge that kind of allows the government to say we're not reopening pay deals, but allows the unions to say we've won more benefits for our workers, and that, as I said, could be a one-off payment. It could be backdating next year's pay deal, which begins April 2023 to 24. Do you backdate that slightly to give people a pay lift for the first quarter of this calendar year? Do you get the pay rise for 2023 to 2024 to kick in April rather than later in the year that typically happens? These are all things that have been discussed, but I think what is clear, we have 2 days of nurses' strikes, one today, one tomorrow. We've got ambulance workers now striking into February, March. It is not going to go away. So the question is whether the pressure ratchets up on the government to move on pay. And I should say that the Nurses' Union has moved a bit. You know, Pat Cullen of the RFCN was saying we demand a 19% pay rise. The government's saying that's simply unaffordable. And then at the beginning of this year, they came back and said, actually, let's talk about 10%. So there is movement. But it is a question of both sides giving a bit. And at the moment, the Nurses' Union is saying, OK, we will move a bit on what we're asking for. And now they're waiting to see what the government will do. But it's not really in the gift of the Health Secretary. This is about, in the end, what the Treasury and the Prime Minister will do. And that's still a moot point, but I do think that these endless situations that the Prime Minister is now in, where week after week he's been challenged on these wait times and these real-life examples of people losing their lives, the pressure's ratcheting up. And as we were talking earlier, just quickly, Labour issued a press release about ambulance wait times, claiming 37,000 patients with conditions like heart attacks and strokes waited for more than 3.5 hours for an ambulance in December, and that costs people's lives, and that's people's loved ones. So this is a very emotive issue. It has real-life consequences, and it's piling the pressure on the government.
No, it really is, Beth. Thank you. And as Beth was saying there, that announcement that the strikes will now go into March, 4 new dates, the GMB union announcing the 6th of February, the 20th of February, the 6th of March and the 20th of March. Now, the nurses' strike, they've just started a 48-hour strike today. It's affecting care at 55 NHS trusts across England. Thousands of appointments could be cancelled over this 2-day period, but chemotherapy, intensive care and neonatal services have all been protected. As it stands, after this 2-day walkout, nurses are planning to strike again on the 6th and 7th of February. The Royal College of Nursing initially demanded an increase of up to 19% to cover soaring inflation. and falls in real-term wages over the past decade. But then said members would be willing to accept a 10% pay rise, with the union's leader calling on the government to meet it halfway. Let's go. Shaman Freeman-Powell is at a picket line at University College Hospital in central London. So 48 hours now, Shaman, more to come in February.
Yes, that's right. The strike action is completely underway. As you can see, there are around, I'd say, between 100 and 200 people on this picket line this morning, invigorated by cars that are driving past and beeping their horns in solidarity with the striking nurses. Not just cars, we've had ambulance and police cars also beeping their horns to give a nod to the striking nurses that they are on their side. And the General Secretary of the Royal College of Nurses has said that the nurses out here striking are doing so with a heavy heart. She claims they don't want to be taking strike action, but this is the only way she thinks the government may take notice, sit down around the table and negotiate pay. And this is why nurses are striking. It's over pay and it's over working conditions. I'm joined now by a nurse who has been in the profession for over a decade working at the NHS. Good afternoon, David. Can you explain to me what you mean when you say that working conditions need to improve? What exactly are you faced with on the front line?
So the reality that Royal College of Nurse members are facing every single day, not just on strike days, is every single shift being understaffed. So what does it actually mean then for patients? It means that their medicine will be delayed. Patients who are in pain will not be having their medicines for 2 or 3 hours. Patients are actually sitting in their bodily fluids for a number of hours because we don't have enough staff on the ground to provide basic nursing care. But what about other services? We're talking about the huge waiting list that exists. But the reality is that we don't have the actual workforce to deliver the actual operations. Unfortunately, if you have cancer, you've got the diagnosis, you're ready to start your chemotherapy, but we don't have enough chemotherapy nurses to actually deliver the chemotherapy cancer services. This is the reality of nursing. Morale is rock bottom. We're still recovering from COVID. My nurse colleagues have died. Morale is at the rock bottom at the moment. The reason why my nurse members are here today is we're fighting for fair pay and safer staffing. And ultimately, we're defending the NHS and we're here for patient safety.
And David, explain what that feels like then. You've just said to me that you've been in the profession for 10 years. You wanted to be a nurse to help people, but you're coming across patients that sat in their own bodily fluids. How do you go home and reflect on your day's work?
It's exhausting. It's mentally, emotionally and physically exhausting. No doubt about it. Nursing is a tough job. It's physically gruelling. The shifts are 12 and a half hours long. So after you've gone home, you're completely mentally and emotionally washed out. And then you're often going to bed and facing it all over again for 4 shifts in a row. That is the reality that my RCN members are facing day in, day out. Now, Stephen Barclay's going to be focusing on we can't be paying people staff, we're going to be removing money from the nursing budget, playing nurses against cancer patients. It's not a case of racing to the bottom, how low that we can pay nurses. My message to Steve Barclay is to do the job. You need to work harder, Steve Barclay. Do the job that you're paid to do as the Health Secretary and get round the negotiation table, meet the health unions so we get a fair pay deal for nursing and safe staffing. We're all here today to protect patient care.
Thank you so much for explaining that to me, David. And as I say, there are, I would say, roughly around 100 to 200 nurses that are on this picket line taking strike action throughout the course of today and tomorrow. And they say that if the government don't sit around the table and open negotiations over pay, then they're prepared to walk out again on the 6th and 7th of February.
OK, Shaman, thank you so much. Well, joining me now is the GMB National Secretary, Rachel Harrison. We saw her make that announcement at the top of the hour. Rachel, thank you so much for joining us. Why do you feel it's necessary to add these 4 new dates?
Well, it's obviously clear that the government are refusing to come to the table and talk to us about pay. So our members wanted to send this message that we will continue with this dispute as long as they allow it to. So by sending this message, we hope they will take us seriously, come to the table and start to talk to us about pay.
And what specifically do you want?
We want an offer on pay to resolve this year's dispute. What we were asking for at the start of this process 12 months ago was a significant increase that recognised the true value of our NHS workers and a plan in place to restore the decade of lost earnings that they've had. Without a true investment in the workforce now, they will continue to leave the service in their thousands. So you can invest as much money into the service as you want, but without the workforce there to deliver, waiting times will continue to increase, handover delays will continue to increase, and patient safety standards will continue to deteriorate. So we need an investment in the workforce now, and that starts with a significant offer on this year's pay and a commitment to talk to us about next year's pay.
They will reply, and they have been throughout this process, that we want to be as reasonable as possible, but it's unaffordable. And if we give you the pay rise that you're asking for, double-digit pay rises, it will embed inflation. The economy will be, the inflation will be out of control, the economy will continue to suffer, and we simply cannot afford it.
Well, we dispute about the impact it would have on the economy. These NHS workers pay taxes themselves. They spend any money they earn within the local communities that they live. So we would argue against that. But what we will say, we cannot afford not to invest in the workforce. We have already seen them leaving in their thousands. There are over 133,000 vacancies across the NHS. And that is why services are suffering, because we literally do not have the workforce there to deliver the care we need to. So we cannot afford not to invest in the workforce. Tell them to come and tell us what they think is affordable, and then we can have real negotiations and we can get a genuine offer that we can take back to our members.
Well, Robert Jenrick told us this morning that he said it would be the worst thing that we could do if the government met the demands of trade unions and increased pay by double digits. The worst thing we could do.
Well, I think the worst thing we can do is let our NHS crumble, as it is doing right now beneath our feet. We all will need our health and care services at some point, and it is our right to protect them. And our members want to do that. And one of the reasons they are taking this action is because they are tired of being prevented from delivering the safe standards of care that they want to. So I disagree with that comment. I think the worst thing we can do is not valuing our NHS workers.
They continually say, we understand the pressures that you are under. We understand that the NHS has issues. They've put a lot of money into it, for £14.1 billion. They say there is a record number of nurses and doctors. Rishi Sunak himself today in PMQs said that there are specific and practical things we are doing to improve ambulance times, and they are clear. They're investing more in urgent and emergency care to create more bed capacity, ensuring that the flow of patients through emergency care is faster than it ever has been. They are saying they are doing things.
Well, we would question what it is that they're doing, where they're investing that money, and how quickly they're addressing that issue. But all of that is irrelevant if the workers are not there to deliver the services. And that's the point that they keep missing. We don't believe they're doing enough. They need to come and actually visit these workplaces. The pressures are real. We have members sitting in ambulances outside accident and emergency departments for their entire shift. That is not safe care. Those are the issues that are not being addressed. And declaring that there's going to be hundreds, thousands more beds in order to clear hospitals is pointless if there isn't the staff there in the community to care for those patients once they've been discharged. The only way the government are seriously going to address the crisis that we're facing across health and care is by speaking to the unions, addressing our concerns and making a real investment into this workforce. And that starts with talking pay now.
And what do you say to the to the argument that by going on strike, you are going to put more lives in danger? The people that you say you are protecting, you are going to put them in danger. Not life and limb, but you're going to put other people in danger.
Well, what we can say is that people are being put in danger every single day due to the fact that this government has chosen to deliberately underfund and under-resource the NHS. We have waiting times for ambulances and emergency care increasing. Our waiting lists across hospitals are increasing. Our handover delays are increasing. There is statistics out there produced by organisations such as the Association of Ambulance Chief Executives that shows the delays are causing significant patient harm on a day-to-day basis. Now, the NHS's own statistics from the previous strike days shows that access to emergency care actually improved on strike days, and that is thanks to our members putting emergency procedures in place to ensure patients could access emergency care if they needed. So what I would say is the government are putting patients at risk every single day, and they continue to do that whilst they're refusing to speak to us.
OK, Ms Harrison, thank you so much for talking to us.
Thank you.
Right, well, with all the strike announcements, you can get a full list of all the strikes taking place across the country. Scan this QR code, there it is, at the bottom of the screen now.